Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Hello, I'm Dr. Bob Russo, the Executive Director of the Connecticut State Medical Society. The Connecticut State Medical Society represents over 4,000 physicians in the state of Connecticut. Its mission is advocacy for the doctors and their patients in the state. This is a continuing podcast. Today's topic is telemedicine. We're privileged to have Dr. David Emmel, who is the legislative chair of the State Medical Society and a practicing ophthalmologist in the greater Hartford area. So, David, let's kick it off with telemedicine.
Thank you, Bob. Telemedicine has been an interesting process through the pandemic. As you know, it's been around a little bit. Its first iteration came from the insurance industry, which had a lot more freedom than providers to experiment with it. But it had very limited capacity to interact with physicians in the state and was utilized to a limited extent. The original rules for telemedicine required that it be a live sort of Zoom-like interaction, patient to doctor, and that was a limiting technology, especially for somebody like myself, an ophthalmologist who services older patients. With the pandemic, we were given the opportunity through the federal government, which loosened the rules for Medicare and Medicaid, and the state through first executive orders and then legislative action gave us the opportunity to be more flexible with the technology. So we had access to the use of text messages, photographs, and even telephonic communication, which was extremely helpful for older patients who may not either have access to computers, smartphones, or may not feel comfortable using them in a physician-patient relationship.
How do you find the acceptance of patients with telemedicine?
Remarkably good. It was extremely fluid. When patients called my office when we were experiencing the depths of the pandemic, it gave me the opportunity to call them back, very briefly explain the process and move forward. It in many ways felt like an extension of the relationship we would experience in the exam room, although clearly without the technology and the diagnostic capabilities.
Yeah, I'm wondering about the connection between the physician and the patient in telemedicine. What are your thoughts on, a physician-patient relationship, follow-up issues, rather than just some of these cold calls that are out there? Do you feel that it's necessary to have an established patient relationship?
Bob, I think without a doubt, there are enormous benefits to having that relationship because right from the start in a telemedicine type encounter, if there's an existing relationship, the trust is there, the process continues smoothly, and patients can explain their symptoms. A plan can be arrived at and a treatment applied and follow up also. So if in instances, for example, where somebody said, I'm having issues of comfort, that might be a single visit by telemedicine. The symptoms go away, we're fine. But if it's something that impacts visual acuity, was easy for me to establish a follow-up visit, even withstanding the limitations of the pandemic. That's not always possible if you're telemedicine communicating with a provider you've never met before. For one thing, the follow-up becomes cumbersome and difficult. And for another, like I said in the beginning, the trust issue is there.
Yeah, I think one of the issues that's come up are the telemedicine episodes being put into the medical record, so that if it's a one-off, it's not in the medical record, so follow-up physicians who may later see a more complicated case don't really know what happened. Whereas with a Connecticut physician, that knows the patient. The follow-up is in the medical record. What are your thoughts on that process?
We absolutely have, seen that occur with telemedicine, especially in its early stages, when these were episodes that weren't communicated to primary care or other providers and was not accessible. And I think that's a great weakness of the system, and the temptation for out-of-state providers to basically interact with Connecticut patients in a way that doesn't integrate well with their entire care. Now, as you know, the State Medical Society is strongly behind a health information network, and we've been promoting that aggressively. That will handle some of these problems and perhaps all of them, but that is yet to come.
So what are we looking for? Tell me what you expect from the legislature and the executive branch that may be able to help us with this issue.
Well, I think, one of the things we've all learned is that over the past 100 years, is technology is here to stay, and the technology advances and drives our habits and behavior. We see that with our recreational use, and it certainly applies to the necessities of life, including healthcare. I think we'll see technology advance telemedicine, and it's important for us to drive it in a way that enhances the patient-physician relationship and use it to its fullest extent and capabilities.
Sounds good. Thank you,
Bob.
David. I appreciate your input in this very serious issue for us. It definitely is our next greatest big step in medicine, to be able to communicate with patients freely and easily, especially in these pandemic times. Again, thank you very much. Appreciate it. Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.